Hi, I'm Mark Lorenzato. This is a short video on hemorrhoid management. In the event that we can't manage it from what I say here and the medications, you'll be referred to either a gastroenterologist or another specialist. So usually when a person has hemorrhoids, that means that there needs to be a lifestyle change. That is, that most hemorrhoids are due to lifestyle problems. Insufficient soluble fiber in the diet. What is soluble fiber? Those are the kinds of carbohydrates that do not get absorbed in the small intestine. They go to the colon where they're absorbed. They bulk the stool, but they have very valuable other assets, including delivering short-chain fatty acids to your system, which is essential. These are foods like vegetables and beans in general. Too much time sitting and poor circulation to the anal canal is very common. I see problems of hemorrhoids frequently, and software engineers who spend long hours sitting do not get up and let circulation happen. So I recommend people frequently just get up intermittently, walk around the room about every 30 minutes, just set an alarm on your machine, stretch your hands, avoid repetitive strain injury, good thing. If you have insufficient physical conditioning, you'll have poor circulation. What I mean by this is you need to be exercising somehow or experiencing physical conditioning is the way I think of it. 30 minutes twice a week, 30, 45 minutes every other day, great. Do something though. Chronic dehydration from sitting inside buildings that are heated, you can feel your mouth is dry, you can feel your skin dries up. Well, there are problems of circulation. Circulation is critical for having your immune system eliminate debris. And the anal canal and the hemorrhoids, one thing that causes hemorrhoids is too much inflammation in the region. Obesity causing increased compression on the anal canal can be a contributing cause. Frequently, obesity in our culture is due to over ingestion of carbohydrates or dairy products, mostly carbohydrates that turn into fats as you flood the liver with them. And poor antioxidants balance from carbohydrates and fats is endemic. It is so common in our culture, it is a great problem. People need to eat more vegetables, seeds, and nuts and stop the carbohydrates and sugars, stop the refined oils from dairy and fried foods. You can have some of those, but we flood our systems with them. Some conditions, disease conditions, cause hemorrhoids. Increased pressure that is downstream from these veins, closer to the return heart from the venous, from the hemorrhoidal plexus or the veins lining the hemorrhoid canal. The anal canal. Liver disease can do this, pelvic disease including masses can do this, and some vascular disease can do this. Chronic intermittent constipation or chronic constipation clearly can be a problem leading to hemorrhoids. And pregnancy is a condition which frequently we find women will have hemorrhoids. What are they? Well, the hemorrhoidal plexus is a set of veins that lines the anal canal. And since the anal canal has to expand for bowel movements, these are coiled vessels that have to straighten out during expansion. They have to have elastic walls. If they become inflamed, they have to have a good immune resolution of the infection or pre-infection issues. They are internal in the canal, and they can extend outside the canal or prolapse out. Frequently when inflamed there is some bleeding, including some bright red blood, and frequently when there is inflammation there is a contribution from a yeast-like, fungal-like infection we call dermatophyte infection. They are mostly preventable by lifestyle changes. Signs and symptoms: pain on bowel movement, sustained pain in the region, usually after. If a hemorrhoidal vein gets thrombosed or clotted, it can be extremely painful and take 10 days to weeks to resolve. There can be an infection that's in the differential of a thrombosed vein. Usually a thrombosed hemorrhoidal vein is abrupt in onset with extreme pain, whereas an infection progresses slowly over time. Bright red blood in the stools or on the toilet paper is commonly seen. It can be due to other causes, of course, which gives us very much alarm depending upon your age group and your risk for cancers, because we should check those things should there be a predisposition to colon cancer or other cancers in your family. Additional tests for this reason may be needed. We may have you get a colonoscopy. We may make sure this is not a chronic ongoing problem causing an anemia. Itchiness in the canal is also common, but it also can be due to other things such as pinworm infection or inflammation from a yeast-type infection. Contributing causes, as I said, yeast, which can happen when a person has prediabetes or diabetes or after antibiotic use. Sometimes there is a food that particularly irritates, causes inflammation in the gut, which will precipitate hemorrhoidal inflammation. Allergens, specific food which we consider sort of toxins, but certain proteins generally trigger this. And some foods, particularly an individual will get to learn they just do not tolerate. So the management, soluble fiber, as I said, vegetables, fruits, beans, avoid starch and sugar, limit oils that are depleted of good, valuable antioxidants. The oils that are rich, extra virgin olive oil is probably the best oil to be using. Limit constant sitting, enhance circulation by getting up walking, and reduce your weight if it's appropriate. Treat an underlying disease condition if you have one. We may have to spend some time diagnosing this. And you can use over-the-counter stool softeners. You may use over-the-counter steroid cream to limit or reduce the inflammation, or a prescription steroid suppository, I may write. If this is not resolving, it really needs further evaluation to understand. There are other theories including banding of a hemorrhoid, which may be done by the gastroenterologist or other specialist. And herbal suppositories and creams, which are over the counter, have various efficacy. They can be very good or not so good. There's a lot of opportunistic marketing, so time of information, check the internet, get some reviews. Consider antifungal medications if this is not resolving. And as I said, treating underlying problems if you're pre-diabetic or diabetic is essential. We can use this to understand your holistic health. Many attributes. Over the counter, the sodium or glucosate sodium is the stool softener, also known as Colace, 100 milligram 2 or 3 times a day. Naproxen is an anti-inflammatory over the counter. If you take it always with food, up to 2 pills every 12 hours for pain and inflammation. Soaking in a bathtub is the primary way of managing an acute episode of hemorrhoids. If you soak twice a day for 30 minutes, usually these hemorrhoids resolve quickly. If you know they're coming on, doing this regularly can prevent them. So I highly consider this. Antifungal medications and remedies, I will probably write either clotrimazole or some other with a steroid like beclomethasone, and steroid suppositories in significant inflammation. A 25 milligram suppository twice a day for 1 or 2 weeks can be very beneficial. In conclusion, lifestyle changes, lifestyle changes, lifestyle changes, but in the event that it's not from a lifestyle problem, we need to understand the underlying illness, made some more tests. So by decreasing the venous pressure, by eliminating constipation, by not sitting so long, things should resolve. A referral to a gastroenterologist, just mention it if this is the second time I'm seeing you for the same problem. Thanks. Take care.